Okay, you guys can grab your PowerPoints and follow along with me. I tried to do this in class today, and it just didn't really work out for me. So a couple of things. You guys can get your PowerPoint, but also if you guys will get your blue textbook, you can turn to page 334, and we're going to look at a couple things on that as well. So while you guys are getting that out, you can pause the video or whatever you need to do so you can kind of get going with that. So a few things about temperature. I know you guys are like, oh, I already know how to take temperature, and you do, I'm sure. But I still want to go over a couple things with you. Okay, temperature is abbreviated T or temp. I think we had that on our paydays for last week. Normal adult range, 96.8 degrees Fahrenheit to 100.4. So all of you guys who come up with like a 99.9 temperature and you're like, Mom, I'm sick, I can't go to school. That wouldn't work in my house because I know 100.5 is not really a fever until you get to 100.5. 36 to 38 degrees Celsius is also normal. So different things that can change your temperature, stress, obviously infection. We know that you get fever when you have an infection. Allergic reactions, exposure, as in like if you get really overheated or if you're really, really cold. Those are things obviously that can change your temperature. Time of day can change it some too. So fever is anything over 100.4 or 38 degrees Celsius. That's 104, 100.4. It's considered, at that point we say that they're febrile. Hypothermia occurs with temps less than 95. So hypo, remember, means low. So that literally means like low heat. Hypothermia is heat. So hypothermia, low heat. Temperature, so some things that are really important to document when you're taking someone's temperature is the degrees, obviously, the site, so where you take it, and then of course the unit of measurement. So if you got Fahrenheit or Celsius, now you're not always going to have to write that down, it's pretty obvious sometimes, but. Okay, different sites where you can take a temperature. Oral, it's under the tongue. Axillary is in the armpit, remember Axe deodorant, think armpit. Tympanic is like the tympanic membrane, that's your eardrum, and then rectally. And then we have another one, the thermoscanner that goes across your forehead. That's another type of temperature that we can take. Typically, rectal is the most accurate. I would say tympanic is probably the least accurate. So if you don't have a good thermal scanner or thermometer, those sometimes are not very accurate either. And then there's a couple different types. There's electronic and glass. And glass thermometers, people don't use them very often, but I would encourage you guys, if you have one, take a look at it. Look at how to read it. There's a line in there that you actually use to read. Okay, temperature, of course, can be assessed in Fahrenheit or Celsius, and we'll always round it to the nearest tenth. So here's the conversion factor. So if you've got, if you have their temperature in Fahrenheit, but you can change it over to Celsius, or I'm sorry, then you can use this bottom formula. So you take their Fahrenheit minus 32 divided by 1.8. Or if you have their Celsius and you're trying to get it to Fahrenheit, you can use this formula. I do want you guys to practice real quick. And you can convert these. You guys can just push pause on the video for a second if you want to. And convert these two that are down here at the bottom. So for 38.2 degrees Celsius, you should get 100.8 Fahrenheit. And then for 101 Fahrenheit, you should get 38.3 degrees Celsius. Okay, temperature procedures. And 334 is where you'll see these in your book. So you can go back to here whenever you need some help. Now, it says one thing you can skip is the gloves. Now, I put that in here just because you don't usually use gloves to take someone's temperature, but if you're afraid you're going to get exposed to any kind of body fluids Or if you have any other inkling as to why you should use gloves, just use them. It's not going to hurt anything to use the gloves. I just don't want you to feel like every single time, you don't necessarily have to use them every time. Precautions. Let's look at some of these precautions. A few things to think about if you're doing an oral thermometer or an oral temperature. Young children can bite the thermometer, so it's not such a big deal with the digital thermometers, but it is a big deal with the glass ones. You want to be really careful. The client needs to be able to hold the thermometer in their mouth, or you have to be able to hold it for them and under their tongue. They can't do that. They're too weak to do that or too young. You may need to do an axillary temp or something. No food, beverages, or cigarettes for 15 minutes before you take their temperature. So you need to ask them, have you had anything to eat or drink? Or have you smoked? And then use a plastic sheath. So those are, hopefully you guys there at your school, you should all have your Vital Sign equipment. Make sure you have a thermometer sheath to put on your thermometers so that you can, they'll stay clean. Let's look at this procedure real quick. Gather up your equipment. Always introduce yourself. It's at the bottom of 334. Identify them by identifying their name. You want to make sure that you're in the room with the right patient. Wash your hands always. Let them see you wash your hands. Put on gloves if you need to do that. And then make sure they're able to hold it and ask them if they've eaten or drank or smoked anything. Now, few things on these. If you got the digital thermometers, kind of like ours, where you just push the button, a couple of hints. One is that if you push it too early before you get it into their mouth, then it will bring the temperature of that way low, and it takes it forever to get their temperature. That can be one issue. The other thing I want to share with you is that you need to clean them with an alcohol swab. So whenever you guys get an alcohol swab, it's really important that you clean them. There's a certain way to do this, and we'll go over this again when we get to the stethoscope. But I want you guys to see. So you have your thermometer and your alcohol swab. Okay, you always, any kind of equipment that you're cleaning, you always wipe from clean to dirty. So the clean part to the dirty part. Dirtiest part of the thermometer is the part that goes in their mouth. Because even though it's going to be covered by a sheath, who knows? What if they bit through it, or we pulled a hole into it whenever we were taking it off, or whatever. So clean to dirty. So start at the bottom, and it works its way up. Okay, so that's how you clean them, and then you put that thermometer sheath on there. I would advise you to do this a few times before you do your skills check in a couple weeks to practice with the thermometer, and especially that thermometer sheath, because sometimes that thermometer sheath can kind of give you fits getting it on and off. Okay, so that's oral temperature. Now, whenever you take off the thermometer sheath, make sure you do that kind of the same way we do with gloves. You don't want to touch the part that's been in their mouth, because then you are going to be exposed to their body fluids. So, okay, the tympanic, it's on page 336. The thing with the tympanic thermometer is that the little sensor that's on the end of that, it has to be able to point at the eardrum. Tympanic membrane, that's why it's called that. So what you have to do is the pinna of the ear is the soft, kind of bendable portion on the outside of your ear. So for adults, you pull that up and out so that you can kind of straighten out their ear canal so that your tympanic thermometer can actually get a read off of their eardrum. For children, you go down and backwards. Let's see, other precautions. If they have a lot of earwax, it's not going to be able to see the eardrum it's not going to be able to get a read off of the eardrum very well, because it's going to be obstructed. They have small ear canals. It's the same thing. You're going to get pretty much, unless you get it right on, it doesn't touch the eardrum, but it needs to be pointing at it. And more, of course, they've had infection or injury. Those are all things that can skew your results. Axillary temperature. Okay, so it says the American Academy of Pediatrics suggests adding 1 degree to the axillary temp for accuracy due to the skin's cooling ability. Our skin, one of its purposes is to cool us off. Okay, it helps us to not get overheated. That's why we sweat. And so our skin typically stays a little bit cooler. So whenever you take somebody's axillary temperature, it's really important that you document their temperature some that you took it axillary, so that you know if they have a 99.9 temperature and somebody just wrote down 99.9, I'm not going to think anything of it. But if they write down 99.9 axillary, I know, okay, well, they're starting to get a fever. That's 100.9. So that's important. You don't write it down that way. You only write what you got and that it was an axillary temp. You don't add the degree to it. Make sure, of course, to use the plastic sheath. You don't want to, like, you know, take your thermometer into one person's room, put it under their arm, and then take it to the next person's room and put it in their mouth. Okay, that would be disgusting, even if you did wash it. And the other thing about an axillary temperature is that the probe needs to be placed in the middle of the axilla, the middle of their armpit, not just like in their armpit crack in the front, but way up in the middle of their armpit with their arm down over it. Okay, so that's how you do that one. And then last one on here is a rectal temperature. Now, typically we only use rectal temperatures for really young babies, infants, and newborns. Now, I always use them. I've used a rectal temperature on my kids until, well, I used one on Hannah until she was out of diapers. And that's always what I use for my kid. They're just easy. They're already wearing diapers. It's no big deal. It takes 2 seconds. I know it's accurate. And so that's what I've always done. If obviously if you're taking a temperature, not of your own child necessarily, but if you're taking a temperature of someone else's child, always have just a second person in the room or have somebody else with you just to protect yourself from, anybody accusing you of anything. For infants, you only have to insert it about 1/2 inch. And so a lot of times, like at Walmart, they make rectal thermometers and they have a little bitty thermometer probe on them, and it's really short so that it won't really let you put the thermometer in too far. A few precautions specifically with rectal temps. One, rectal tissue is really fragile. So if you're doing this on a baby, you want to make sure that you've got a good hold of their legs. They're not kicking around and moving all over the place. It's not for use in people with a history of cardiac disease because that can cause like a vagal response, and it can cause them to have heart problems. Injury or surgery to the anal rectal area. Obviously, if they have had surgery to that area, you wouldn't want to put a thermometer there. Or any kind of recent treatments like chemo or radiation or steroids. The reason that it's got chemo and radiation on there is because those two things particularly make all of your mucous membranes really, really fragile. So I had a friend who was undergoing chemo and radiation and taking a whole bunch of steroids for she had leukemia. Anyways, and her whole mouth and all the way down, they said her GI tract was just completely ulcerated. It just looked completely miserable. And so that's why it's just really ultra fragile. Obviously, you want to wear gloves for this kind of temperature. Watch out for poop. Okay, so babies in particular, whenever you put that thermometer in their bottom, it automatically stimulates a reflex for them to push. And they can poop on you. It's happened to me before, so that can happen. And then, of course, the post-procedure, just make sure you keep people covered up. You want to make sure that you maintain privacy, even for a baby. I mean, that's still important. You still don't want, that's still important. They're still a person. They still have their dignity. So that is temperature. I do want you guys to practice on each other. You might get a couple people. I'm going to send you guys a little like a chart for you guys to keep up with the people that you are taking their vital signs. Write their name down and fill in the chart beside it. That way you can keep kind of a running log as you practice. Okay, and that is that.